we promised that we were going to do this in November. They asked us, they said, one of the biggest things we need is a microscope so we can start sending you slides and start sending you images from our pathology department, because our 2 pathologists in the entire country are overwhelmed. And so we figured out that Northwell can help with that. We have tons of pathologists that can help with that, but we can't send all the pathologists down to Guyana. So this was a very technologically simple answer, a microscope with a camera so they can take pictures and send them up to us.
We know that this is one of those things that can be easily solved because the microscope with the camera will just set the framework for what we can do in the future, which would be to have residents come here to expand their knowledge of tropical diseases and work in a low resource department, as well as have members of their department come to the States and get additional training and then bring that training back here.
Last year around October, when I was asked to coordinate Northwell visit, I was wondering to myself if this was another group that usually comes and sells all the dream. But then I said to the team, this an opportunity knocked once at every man's door, and I think this is one that we need to go after.
Yeah, it was about $125,000 worth of equipment. We sent 2 surgical trainers down that were laparoscopic surgical trainers, so their surgeons can practice manipulating with laparoscopic instruments, with the hope that we're going to start doing cases together and they're going to learn laparoscopic surgery from our Northwell surgeons. And then the bi-pap machines. The bi-pap machines, these are machines that were life-saving during COVID. We actually were the first health system to figure out how to make them invasive ventilators using a 3D printed piece. So those things are super important. So these are kind of very utility machines. They don't have any, they now have 7, and we told them that part of our donation to them is to make sure that this is not just action, but sustainable action, and so we're going to teach them how to service them, we're going to teach them how to fix them when they break, and I sincerely hope, and I'll say this over and over again, that we don't end up creating an equipment graveyard in Guyana.
We need a microscope. It's very costly, it's very difficult for us to source, and I had a plan to ask Northwell for this. But before I could have asked, they offered. So these are the kind of relationship we want to build. It's a partnership, it's a family, it's an extended family now.
People can come down, and other entities have come down promising the world, saying they could do all these things, and then they fly out of the country and it's radio silence. And it becomes kind of on the Guyanese organizations to maintain that connection. And that's not fair. It's not the way partnerships develop. And the problem is that you almost form this cynicism to kind of global humanitarian aid, because you're like, well, you're going to fly down here, it's going to be important when you're here, and then when you're back, we're out of sight, out of mind. And so we're doing things differently because we're following through on our words. We're proving that actions matter, sustainable action matters even more than just one-off actions. And anyone that has any doubt about Northwell's intentions in Guyana, whether we're being opportunists or whatever, I've just told them, walk with us for a little bit.